we both work in emergency rooms, and we want to give you some advice about when to come to the emergency room. When should you seek our services? When should you either drive your child to the emergency room or potentially even call 911? So the advice from the American Academy of Pediatrics basically says this. If your child, you know your child best. If your child is acting strangely, is becoming more withdrawn, more or less alert, that would be a time to seek immediate medical attention. If your child goes unconscious, if they don't respond when you talk to them. Now, we're not talking about teenagers, because they invariably don't talk to you when you don't respond when you talk to them. We're talking about little kids. It's right. If you're an older baby or your toddler who normally, hi, Johnny, and the baby turns and looks at you, your baby's not doing that anymore. Your baby's unconscious. Call 911. You want to seek medical attention immediately. Any type of rhythmic jerking or unconsciousness, that combination can be what's called a seizure or a convulsion. That needs to seek medical attention immediately, and 911 certainly is there for you. Any increased effort or trouble breathing, if it looks like the baby's working, if their ribs suck in, if their belly's going out, they look like they're working to get every breath in, that would be a reason to get your child evaluated immediately. If their skin or their lips look blue, purple, or gray. If your baby looked dead, you shook your baby a little bit, now he looks fine, you still want to seek medical attention. That can be a true medical emergency. There's some not serious causes of that, but some very serious causes. So again, if the skin looks blue or purple or gray, if it still looks that way, you definitely want to call 911. You want to get medical attention. But even if now it's resolved and your baby looks okay, that is still a true medical emergency, and you need to get your baby evaluated. If your baby has any neck stiffness or a rash associated with a fever, that would be also reasons to seek medical attention immediately. Call 911 or get your child to an emergency department.
Now, a few other things, again, from the American Academy of Pediatrics of reasons to come to the emergency department is any increasing or persistent pain that your child has, come on in. Come see us, because we'll help. I don't care where that is, increasing or persistent pain, abdomen, chest, extremities, you name it. You bring them in. We'll take care of them and figure out what that is. Any cut that involves the head, chest, or abdomen, we need to take a look at to make sure that it didn't go any deeper and involves something that's really quite important, or any bleeding that doesn't go away within 5 minutes of direct pressure. You're going to put direct pressure on anything that's bleeding. If it's still bleeding after 5 minutes, come on in. Any burn that involves the face, that involves the hands, the feet, the genital region, the facial area, some parts of the chest, bring them in to see us. So if they have blisters that are involved in the area or anything more serious, bring them in. They've bitten an electrical cord and they have a burn in the corner of the mouth, bring them in. We need to see those children. And any child who's had a loss of consciousness, they fell, they hit their head, or they just passed out and now they're confused, they have a headache or vomiting, bring them in. Those children need to be seen by us. Those are all kids that need to get brought to the emergency department, and we'll evaluate your child, we'll do a history and a physical exam. We may or may not be doing tests depending on what our history and physical and what you tell us sort of indicates, but we need to see your child to make sure that they're okay.